We've been here for over 40,000 years, and according to our culture, we've been here since the beginning of time. But it's important that we always think about our health. You know, we might go down the path of drinking and smoking and our, you know, the way that we eating behaviours. But if we want to reduce the amounts of chronic disease amongst Aboriginal and Torres Strait Islander people, the way we've got to do that is it starts with ourselves. We've got to start eating good, drinking lots of water, being active.
At Wuchopperen, what we try to do is go back a step, which is the first thing we should do is actually screen the population for early risk factors, intervene with those risk factors and prevent the development of a chronic disease. If that same message of motivation and life change comes from many sources, then surely that must be more effective. So what does team care mean? It just means a whole bunch of people that are good at one area combining their efforts for the benefit of a client. I'm Vlad Medic and I'm the Director of Medical Services here at Wuchopperen Health Service in Cairns. The main function of my role is to try and improve health outcomes for Aboriginal and Torres Strait Islander people. So there's a lot of talk about closing the gap, and I think sometimes people lose sight of what that gap is, and that gap is a gap of life. We have huge numbers of diabetes, cardiac disease, cholesterol issues, blood pressure issues, renal disease, and then a myriad of complications of those diseases as well. Or, unfortunately, as the majority of people suffer, is a combination of those diseases. Basically it's GP centric and GP referral driven, but to me it's a natural flow on of the answering the demands of people. So for instance, in diabetes, the best practice care is if you have a blood test probably every 6 months, that's fine. A kidney test every 6 months, that's fine. But you should also have your feet checked every 6 months. The best person for that is a podiatrist, so we have a podiatrist on staff.
My name is Daniel Finn. I'm the podiatrist here at Wuchopperen Health Clinic in Cairns, and you also see people. A majority of my patients are diabetic. Okay, Larry. So yeah, today I'll be doing a diabetic foot check. So I'll be assessing the blood flow and the sensation in your feet, and just take care of anything else that needs doing while you're here. The doctors will refer a patient to us, particularly if they've got diabetes and if they're having trouble controlling their diabetes. For example, if their blood sugar level is poorly controlled, they may lead to complications such as issues with the nerves in their body, so they may have trouble feeling things under their feet. They may also have reduced blood flow to the feet as well, so you may see a slightly deformed foot with clawed toes, maybe flat feet. So sometimes the nerves that control the smaller muscles in the feet can be affected, and so they start to waste away, and so the larger muscles in the leg might dominate, and you get deformities start to form, and they might get a high pressure area under their feet which may possibly lead to an ulceration. Do you get that pain in the heel in the mornings especially, or just any time?
Even when I get out of bed midnight till 12 for some reason, and getting on that feet is just...
I guess I try and relate why their foot is the way it is in regards to their smoking. So like I say, if it's a dry, scaly sort of foot, thick nails, that's a good visual sort of representation of what smoking can do to their feet. So one of the things that smoking do is lead to, I guess, poor circulation in the feet. So it might present with, a drier sort of foot type. Their nails might be a bit thick and crumbly, might change colour, that type of thing.
Yeah. Yeah.
Excellent, no problems at all. Very good. Alright, so the next thing, regular checkups is helpful, so we can pick up on any issues straight away. The sooner we pick up on an issue with the feet, the better the outcome for the patient. Otherwise, yeah, it's just that the longer it goes on for, the poorer the outcome.
Your eyes should be checked 2 yearly. I think the Commonwealth likes. At Wuchopperen we believe it should be annually, so we have an optometrist on site. Now, I think Fred Hollows once said no measurement without treatment, so it's not just a matter of diagnosing a problem but being able to do something about it. So here we also have a spectacle dispensing system so that people can get no cost or low cost spectacles.
My name's Michelle. I am the optometry assistant here at Wuchopperen. We do the dilation test so that we can then get the photographs done. Our optometrist then looks at the photographs, has a look at whether there's anything there that needs to be seen to by an ophthalmologist. So Wuchopperen does that side of things. Then we pass them on to an ophthalmologist locally here so that they can then be treated if needed. Thank you.
Thank you.
I'm Lisa Penrose, optometrist from Wuchopperen Health Services in Cairns. The patient's journey can vary depending on the work schedule of the clinic, and some people just will be coming to see me, but most of them are going to be seen by several people at the clinic. This is the sort of view that I'm able to get on my microscope over there, and then we'll take photos of the back of the eye. Really looking at the blood vessels, the eyes are the only part of the body that you can directly view the circulation system. So it's a reflection of the circulation system throughout the body. So if we look at this, the back of this eye, we can see there are hemorrhages here. That's from diabetes. There's also exudates, lipid exudates. They've leaked out of the blood vessels. This is a reflection of what the kidneys will look like everywhere in the body. And you're wearing them all the time pretty well? Yeah. All the diabetics will be seeing the podiatrist and myself, and interestingly I find that my notes are almost a reflection of the podiatrist's notes. If someone has retinopathy, their feet will be in a bad way as well. The advantage of having me here now is that we can screen for this, so if I do refer someone on for their eyes, we all know it's very important that that person gets to that appointment. The complications make the diabetic retinopathy worse. It's all interrelated. Yeah. So smoking general health impacts of smoking will increase the likelihood of diabetic retinopathy. It is often successful to increase their motivation to stop smoking. They'll be more inclined to seek the other services we have in Wuchopperen to assist them in giving up smoking. The eye can still get damaged from the sun. Yeah, a lot of people don't realise that. So sunglasses, and the sun causes cataracts.
GPs, as well skilled as they are, probably don't have the time to sit there and show a patient how to use a blood sugar measuring device, or what is the frequency, or how to keep a logbook or so on, and also to explain to people a little bit about what their to explain even more than the GP has in terms of what their medication is doing and so forth. And that's where the diabetes educator comes on. So we have a diabetes educator on staff.
Have a seat. My name is Tony Pappas, and I'm the diabetes educator at Wuchopperen Medical Service here in Cairns. So how long have you had diabetes?
About 15 years.
15 years. And you're on tablets for that? For the initial visit, I keep things pretty simple and straightforward, because it's good to give clients something that's practical they can do and see what they're doing that's working well for them. So so first of all, I look at how long they've had diabetes, their medication that they're on, whether they're on tablets or insulin, and their knowledge of those, and if they're taking them regularly. Also, it's important to be in the National Diabetes Supply Scheme, so make sure they've got a card and they know what that entails. And also, if they're monitoring, if they've got a blood sugar monitor.
I've booked into the exercise guy here at the
Yep, the exercise.
But I haven't met with him yet, so for the gym. And I've got an appointment with the dietitian.
Yep.
And at the moment
I find out if they do smoke, and then get and ask them how long they've been smoking and how many cigarettes they have a day, and I talk about would they like to stop, and have you been smoking for a long time?
Since I was 21.
Since you were 21, yeah. So it's quite a number of years. So it's a big step to think about stopping now, isn't it? Yeah. And so how do you feel about that?
Oh, I want to stop.
You do?
It's just that because it's addictive, I can't.
Yes, yeah.
I would love to stop today.
Smoking's a big thing. There's a smoking team, a smoking counselling team at Wuchopperen, and the health workers and doctors and dietitians. You know, it's one of the questions that's often asked. So if people aren't ready or do not want to stop, then I just note that, because it'll be mentioned again next visit by one of the team anyway.
On top of that, people are well intentioned in terms of trying to lose weight or improve their diet, but once again, GPs are just too busy to sit there and give people the time they need and to analyse their dietary patterns and see how they can be improved. Hence, we have a dietitian on staff.
My name's Sue, and I'm the dietitian here at Wuchopperen Health Service. So what that means basically is I work in a job where I'm helping people to understand more about healthy eating. We have a number of allied health professionals, so that's podiatrist, optometrist, diabetes educator and myself. And so if somebody is waiting in the waiting room to see the doctor and we are aware that they're waiting and they have missed an appointment with us, then we will just go and invite them to come and talk to us about their nutrition or have their foot checked or get their eyes checked or chat to the diabetes educator. Choosing the right foods to manage their diabetes and understanding that what they eat really does matter with their diabetes, and it can make a difference to their eye health, their kidneys, their feet, all of those things if they just choose to, linking what they eat with their overall health situation. Heart health, I try to make it visual for the clients, and I'm saying that what we want is that we want our blood vessels to be nice and clear like this so that so the blood can flow easily. And I often say to people, when this is not happening and it's getting blocked up, it doesn't cause us any pain. So that's why it's really important to have our checkup with the doctor and do the blood test that our doctor tells us, suggests that we do. For example, the meat that we eat really matters, because if we're eating the meat and it's got all of this fat on here, like this picture shows, this is how much fat is inside that meat. I also use this quite a lot. This is the Aboriginal Torres Strait Island Guide to Healthy Eating, and it's basically trying to make it contextual, the mainstream eating guidelines, including bush foods here in the meat and protein foods, making sure that we include, like I was saying before, tin foods and frozen food options, tin fruit, powdered milk options, things that are more common in this context for people to be using as their food sources. I find if I say to someone, what do you have for breakfast? And they say to me, I don't eat breakfast. My very next question is, are you a smoker? Because often the smoking can displace good nutrition. So people will be focused on their smoking habit, and as well as the negative effects of smoking in itself, it also has a secondary effect often on areas like nutrition, because it's substituting eating well. The other thing that is interesting with smoking and nutrition is weight control. Sometimes the two go quite in hand. Some people will be smoking, and one of the things that is preventing them from wanting to quit is their weight management, because it actually sometimes decreases their intake, and so they're hesitant to be quitting, knowing that they might replace it with food.
Yep, awesome. I'll just put that one there for you.
So even though we don't get specifically funded for dental, we deliver dental care here at Wuchopperen because, well, I think it's just basic. If you poor dentition probably leads to poor diet. It's very hard to eat healthy food with no teeth.
My full name is Manjunath Rajashekar, but you can call me as Manju. I am the dentist here in Wuchopperen. So as you know, Wuchopperen is a health organization which provides the holistic health services. That means the people right from the birth, they will get all type of the services, including the maternal, like the chronic diseases and everything. And here we are providing the oral health services. So we have got 2 surgeries here, and also we have got an outreach program that is in Atherton, where we have got a very well new dental van which has got all the facilities just like a dental clinic with the X-ray facilities and everything. Just put the chair back. It's not just the extractions. We are now giving more and more importance in saving the teeth, because in case of diabetic patients, the periodontal health, what we call it as the gum, so they will be having a lot of gum problems. And so if we just keep on extracting, like removing all the teeth, so one day they will be without any teeth. So what we will be doing is we are just giving more and more preventive oral health services rather than just the emergency. And it's very important to educate the expectant mothers, so because they will, if we educate them, they can educate their children. And also especially during, and the recent study has shown that within 6 years, most like 50% of the children are getting the dental decay. So that means there's a lot of problems that is going on, especially in that particular age, and whatever they are picking up that particular age, the healthy or unhealthy lifestyle at that particular age will be there for lifelong. Your teeth, most of your teeth are untreated. That means they have become flat. Okay, so you know, like the teeth should have, like, smoking has got, I can say that it has got a direct relationship with the oral health. So the people, especially they will be already having so many conditions, like as you told, cardiovascular problems, diabetics, plus the smoking, so that will increase the oral health problems maybe 8-fold. Like their gums, the immunity, the immune response for any diseases from the oral cavity would have been reduced by 8 times in the people who are smoking. And also there are different forms of tobacco that they will be taking, maybe smoke form of tobacco or smokeless form of tobacco. But I think in the Western countries it is mainly the smoke form of tobacco, that is in the form of cigarettes or the raw form of tobacco. And it also depends like what type of cigarettes, it's a filter one, non-filter one, whether it's a raw form and all. And if it is a raw form, they have got a direct, because there is nothing, no filter, so the carcinogens, they will be directly in contact with the tissues, and their healing capacity will be reduced, and their the immunity will be reduced, and also, as you know, they will be more prone for oral cancer. If the one puff of smoke has got thousands of carcinogens, and it's not just the oral cavity, but it affects all parts of the body. So because of the smoking, because of just one puff, the blood flow to the tooth itself will be reduced. Smoking plus these chronic conditions will have got a direct relationship with their oral health.
A lot of people would probably have an inner motivation to actually get out and exercise or walk more or just be more active in general. But once again, as a GP, I don't think I'm the best person to guide somebody in the development of an exercise program, hence we have a fully equipped gym and exercise physiologist on staff.
I'm Kush, I'm the exercise physiologist. I'm working at Wuchopperen Health Service, and we started this new exercise physiology service about 2 months now. The aim of the service is obviously to work with indigenous population and get them stronger and fitter. Exercise is an important part of the whole holistic health, and that's why Wuchopperen has started this service. We go through some basic exercise testing to see how how they respond to exercise and where they are standing at the moment, and depending upon that we prescribe exercises. People who are suffering from chronic disease like diabetes, to heart failures, to cardiac myopathies, to even we're planning to run a cardiac rehabilitation group here soon as well. So the aim is basically, depending upon their medical condition, prescribing exercises in a safe way so that they can improve their overall health and their lifestyle. If you can replace one habit with the other, which is an exercise, it can help in neutralizing the smoking habit, you can say that. So exercise does comes in and help in people getting away from or quitting smoking. It also helps in improving the metabolism and the overall body physical endurance. Once I get the results, then we go through about 3 to 4 weeks of program where we try to cover up, we set some goals, mutual goals, clients' goals and mine goals, and try to work together and achieve those.
So at Wuchopperen we actually host the regional anti-smoking initiative, and we're slowly developing yarn-up groups or other pathways, and that team is out and about in the community busily health promoting and trying to stop, once again go back to the start, which is stop the young'uns from smoking. Get early smokers, get them to quit, and get hardened smokers to quit as well.
My name is Nelson Lee. I'm the Regional Tobacco Coordinator here. I'm an employee of Wuchopperen Health Service. The role of a Regional Tobacco Coordinator, it's looking at a regional area where we cover from the north of Cairns, from Mosman down to Cardwell south, and to the west, Croydon. So as an employee, it's a significant role as a Regional Tobacco Coordinator is to look at the delivering the information and the tobacco and smoking cessation and increased physical activities within the communities who we work with, and as part of a national initiative in tackling Indigenous chronic disease. Our main message is to educate and to encourage the community members to actually come into the clinic to get the health check. Our role, or as a team, is to work with the clinic. It's to provide information and all the necessary support that is required of the community, especially looking at the social, emotional and spiritual well-being of the communities, and providing that holistic approach and support.
Pretty much what we're going to invest in this period here.
My name's Terry Joinby. I work at Wuchopperen Health Service, and I'm a tobacco action worker. As a tobacco action worker, our role is to spread the message, I suppose, through our regional areas on the harms and that are associated with tobacco smoking, and assisting those who may want to give up or just wanting to know some more information about tobacco itself. When we go to a community, the tackling smoking and healthy lifestyle teams, we do tend to travel together, because a lot of people who may want to be giving up the cigarettes are not sure how to balance it out, keeping a healthier option. So we do travel together mainly as a team.
My name's Jason Von Rule, and I'm a healthy lifestyle worker here at Wuchopperen Health Service. My position as a healthy lifestyle worker involves basically providing health promotion activities throughout the region, working with the different stakeholders, health services, schools, attending community events, and at those places that we go to, working with those stakeholders to provide nutrition and physical activities. Our programs involve tobacco awareness and physical activity and nutrition awareness. So we like to merge all of those into the one program. I look forward to the day when, we look at the statistics between Aboriginal and Torres Strait Islander people and non-Indigenous people, and we're at the same level.